PPT is visible and I'm audible to everyone.
Yeah, ma'am, your PPT is visible and it's audible.
Good afternoon, all the participants. Today we are on the 8th day of 12 days webinar on newborn care of nurses. Today's topic is Kangaroo Mother Care. Hope all of you are with me. So, 20 million low birth weight infants born globally every year, out of 8 million are from India. 80% of the neonatal death occurs among small infants. Out of 65% are preterm infants and 90% are small for gestational age. And India has the highest number of preterm births and also accounts for the maximum number of neonatal deaths due to prematurity. And the incidence of low birth weight in India is almost 27% of total live birth. So all these numericals figure is at this point of time, since globally we are so much advanced with healthcare practices and we are integrating artificial intelligence in healthcare practices, still these percentages are quite concerning or alarming for our healthcare providers. Why before starting the topic of Kangaroo Mother Care, I came with all the statistics is in all the cases in preterm babies, in low birth weight babies, and small for gestational babies, hypothermia is a major concern to address. Even the normal babies also we have to address hypothermia, but still in all these cases, it is a major problem. 100% of babies we have to take care of thermoregulations. So just to make you understand the statistics, how important is thermoregulation. Now, how this has emerged, this name has emerged, Kangaroo Mother Care. Kangaroo is the national animal of Australia. Kangaroo as an animal, the mammal delivers a premature baby. Since the animal delivers a premature baby, the kangaroos will keep the babies in their pouch to give warmth and to initiate breastfeeding. So that's why we have adapted the name from our nature. Just a history, it was started in late 90s, actually in late 70s, 1970. The term pediatrician, this term Kangaroo Mother Care was pop up by the pediatricians from Institute of Columbia. And in India, it was initiated in 1994. It was actually practiced in KM Hospital, Mumbai, and All India Institute of Medical Sciences all over in India. Followed by it was adopted into PJ Medical College Hospital, Ahmedabad. Then WHO has formally enforced KMC and published the practice guidelines in 2003. And from WHO, Indian Ministry of Health and Family Welfare has made operational guidelines for KMC to the healthcare settings and to improve the optimal feeding of low birth weight babies. That has happened in 2014, means almost a decade back. So that is just a history of KMC. It's very small topic. Then KMC, Kangaroo Mother Care, it's a very simple method of caring low birth weight infants. It's not for low birth weight infants, even for normal babies also we can give. The main concern is we have to address the hypothermia, but additionally it has so many other benefits. So low birth weight infants, that includes early and prolonged skin-to-skin contact with the mother or a substitute caregiver, and it promotes exclusive breastfeeding for the baby. As in the definition we have seen, it has two components. The first component is skin-to-skin contact to address hypothermia. The second is exclusive breastfeeding to address the nutritional point of view. Skin-to-skin contact is a direct, continuous, prolonged skin-to-skin contact is provided between the mother and the baby to promote the thermal control. That is to address the hypothermia. It's the major problem in all the babies, irrespective of normalcy and abnormalcy. Every newborn babies face the problem of hypothermia. So we address that. Second important concern is even for normal babies, it's feeding. Skin to skin contact promotes the lactation, and feeding interactions with exclusive breastfeeding promote the adequate nutrition. That's why the child improve the desired weight gain. For normal babies also, it there is a desired weight gain for a baby after the birth. So that will be addressed by giving exclusive breastfeeding. The major components of survival of a newborn is hypothermia corrections and nutritional point of view that will be addressed by providing KMC. The important note to take off there is here is newborn infants less than 200 grams should start with KMC on priority basis. That should word is capital letter underline. So less than 2 kg has to start with KMC. Next, we'll see what is the duration of KMC. It actually does not have a defined duration setting. For 4 hours, suppose daily we are providing KMC, we can say it's a short duration one. More than 4 hours, that means 5 to 8 hours of duration can be an extended KMC. 9 to 12 hours daily, if you're providing, then we can categorize it under long duration KMC. If it's more than 12 hours daily, it can be continuous KMC. Now, what benefits we are getting out of it? Of course, we said thermoregulation and nutrition is the major concern of address, but still there are some additional benefits which we cannot neglect it. The first one is maintains thermoregulation. Once thermoregulation is maintained, the body metabolism will be initiated. Once the metabolism happens, there will be release of energy. The heat will produce within the core body structure, so that regulates the thermoregulation. So important part. When there is a metabolism, you feel hunger. Your body needs, your body is working properly so that the requirement of energy, the demand of energy will be more. So once there is a demand, the breastfeeding will be automatically initiated. If the baby is placed on mother's chest, the sensory stimulation, all the 5 senses, vision, eye-to-eye contact, even though there will be a blurred black and white vision, but still it should initiate the eye-to-eye contact. Then smell of the mother, odor of the mother. Then baby's odor will initiate the oxytocin and prolactin reflex, which initiate the breastfeeding for mothers who are having any feeding difficulties. Then the baby can listen to mother's voice. So it enhances the sensory perception of the baby. Its brain development will be initiated because the sensory stimulations in all the 5 contexts, touch, that is skin to skin contact. So it's all the 5 senses are highly initiated at the very initial stage of your life. So that enhances the stimulation. Since the baby is placed in a prone position, the diaphragm will be down. So there the lungs have enough space to expand, which leads to less prone to respiratory issues, apnea. Protect from nosocomial infection. So you are with your mother, definitely the clean and hygienic environment will reduce the nosocomial infection. Hospital-related infections will have less chance to get for the KMC babies. Since the metabolism is good, the baby try to get more feeds, baby demand feeding. When the baby demand feeding, there will be better weight gain for the baby. It reduces the prolonged hospital stay that leads to early discharge. So in cost cutting, hospital stay, it benefits in all the dimensions. And better neurological development, as we have discussed, all the senses will be stimulating. It helps in the brain development. The baby will be intellectually good. It facilitates the psychological bond between the mother and baby, especially for primates. It's difficult to initial phase, it is very difficult for to adjust, but that postpartum psychosis, she will be very happy and bonded to the baby, so that kind of psychological issues can be addressed. Found to be more effective than incubator care for stable babies. No need to keep in incubator, which leads to nosocomial infection, which leads to so much of financial burden. So if baby is stable, only the concern is to address hypothermia. Kangaroo Mother Care is the best alternative for that. And one of the best method for transporting very small babies. And increase the opportunity for parenting, so they can cuddle the baby, they can talk to the baby, they can see the babies. So it improve the parenting skills. It improve the attitude of parenting skills. And it increase the opportunity for parenting. Does not require any staff to compare the incubator, and it is very less expensive in comparison with incubator and radiant mobile. So these are the benefits. even though it is a very normal procedure, but still there is an eligibility criteria. We can give to all the babies, irrespective of their weight. Newborn babies can be given if they should be stable. Health-wise, they will should be stable. But there is a defined criteria for the babies. All stable newborn babies less than 2 kg, soon after the birth, has to get KMC to improve the thermoregulation. Second eligibility criteria is sick low birth infants few days after the treatment. So low birth weight baby, immediately they will be under critical care in newborn, in NICUs or under critical care settings. So after they stabilize the newborn low birth weight babies or premature babies, after few days of treatment, when they are stabilized, you can start KMC for them. And the babies whose weight is less than 1,200 gram babies with severe prematurity, after few weeks for birth, you can start the treatment. Treatment versus KMC. Now, less than 1.2 kg, that is 1,200 gram. So we expect the baby who, irrespective of their gestational age, the baby's weight less than 1.2 kg, we expect serious prematurity. Okay, so may take 2 days or weeks before the infant's condition allows the KMC. So they have to be in the critical care settings for a few days or weeks before starting the KMC. And duration of KMC should be gradually increased. We cannot go for a continuous KMC. So we can go for a short KMC for 1 or 2 hours. In the NICU itself, you help them, you teach the mother for giving KMC for 1 to 2 hours, and then you can start with the KMC after since the baby is tolerating. Then if the weight is 1.2 to 1.8 kg, may have some significant problems. It may take few days before initiation of KMC, and infants needs specialized newborn care. And intermittent KMC can be given when the baby is hemodynamically stable, even though the baby receiving IV fluids, antibiotics, or any kind of additional oxygen supplementation. Still, along with that, you can practice KMC, but the baby should not be under critical situation. And initially, you should help the mother, and she should practice it under medical supervision. And duration can be gradually increased, and then you can transfer the baby out from the ICU. If the baby is of a normal weight category, that is more than 1.8 kg or less than 2.5 kg, so almost near into the normal weight, the infants can generally start with KMC. They should be stable at birth. So you can immediately start KMC after their birth. Then comes who can provide KMC. The word is Kangaroo Mother Care, but it can be KFC, that is Kangaroo Father Care. It can be grandmothers, who our family members very close to the child, immediate relatives can give it. Mother is the best choice. Mother, father, or any adult members of the family can provide KMC. First thing is they should be willing enough to give the KMC, and their health should be good. They should be free from any serious illness, especially infections, respiratory infections, or any other kind of systemic infections, and should maintain the basic standard of hygiene. Like they should do hand washing before starting the procedure, should have a daily bath, they should cut short their, clip their fingernails, tie up their hair, wear clean clothes when they're doing KMC to avoid infections, because baby will be prone to infection because of immunocompromised condition. Then if those who are providing KMC should not wear the jewelry, watches, and spare any threads or something which they are wearing should be removed, so that these all things can be a barrier of infection, or even some jewelries might cause injury to the child. So make sure that you should remove all these jewelries and watches things. Now, how to provide a KMC? So the counseling part is the first one. Initially, when we have introduced in Indian settings, or when you go to clinical setting and ask the mother to provide KMC, there may be a resistance. Many of them will resist. So the best way or to avoid or to control the resistance is counseling. Counseling is the best when nurses are the people who are with 24 into 7 with the patients, and you have to counsel them, especially primary mothers. So the effective way of overcoming these socio-cultural barriers or anxiety of primary mothers or anxiety of postnatal mothers is by counseling. The first counseling session should be organized at the convenient time of the mother. When she's in a pain, when she's feeding her child, should not go for counseling. Choose a comfortable timing or convenient timing from the mother's side. At least the first counseling. And first few sessions should be extended interaction. You try to develop a bond, start talking to them, get the history, address their concerns, and then slowly introduce about the topic of Kangaroo Mother Care. And initially, after creating a rapport, after maintaining a rapport, you demonstrate the correct position in caring, gentle manner with patience. Okay. So definitely, it will be a time-consuming process. You should not be in a hurry. Demonstrate correct position in a caring way. If she have any query, the mother have any query, address it properly, post with a positive attitude. Encourage her to bring her family, the husband, mother, or in-laws, whoever is supporting her during the postnatal period. Just along in their presence, you try to teach her so that it can be group health education way. Build a positive attitude with the family members and ensuring the support for the mother and help her to interact with somebody who's already practicing KMC, especially in the postnatal wards. Next comes a pre-request is what all materials we require for providing it. A reclining chair, which you can see in the picture above, a reclining chair or an adjustable backrest with an extra pillow or an ordinary chair will also do. The main purpose is the back of the mother should be straight. And for mother, she requires an front open light dress or a nightie as per the local culture. Then KMC works well with sari and blouse also, or gown and shawl also. These are the requirements for the mother. For a baby, a front open sleeveless shirt, cap, socks, disposable diapers, mittens, small mittens made of soft natural fabric like cotton. Not mandatory to have special dress or garments or binder for KMC, but still kangaroo bag is there, but it is not mandatory. It can be provided by any clothing that is acceptable to the mother and family. For Kangaroo Mother can not explain the mother to purchase something new. So, but still Kangaroo bag is available in the market and baby bag is also available in the market. So that if you are able to afford it, you can go for it. You can give an options for the mothers. Then comes the position, a very important part of this. What is the position? How the baby should be placed. Since you have seen it in picture, place the baby between the mother's breast in an upright position. So keep the baby in an upright position, head up and body parts low, the upright position. Turn the baby's head to one side in a slightly extended position, which helps to open the airway. And mother and baby should have an eye-to-eye contact, and the nose will not be blocked. That is the second thing. And if you see the baby's hip, it should be flexed and abducted like a frog-like position. See? So it is flexed and it should be abducted like a frog-like position. The arms should be flexed and placed on the baby mother's chest. You can see it in the picture, how the baby is placed. Baby's abdomen should be placed at the level of mother's epigastrium. And once the placement is proper, you support the baby with a sling and binder so that the baby the binder should be tight, should not be loose. And baby's neck should not be too flexed or too extended. If it is too flexed or too extended, there will be blockage of airway. So it should not happen. There should not be too much flexion and extension of the neck. So this is the ideal position of placing the baby for KMC. Practically, initially, as a nurse, you should be able to know how to place the baby for KMC and teach the mother. Make sure that 2-3 times you be with the mother. Let's see how she's practiced. First time you demonstrate, second time you demonstrate, and third time ask the mother to perform it and you supervise it. Make sure that if you are confident enough in mother, then you can ask the mother to perform it independently. Then mother who's carrying an infant in KMC position, she can walk, stand, sit, or engage in any different activity if she is comfortable. If she's comfortable. And even if she can sleep, if she's highly confident and comfortable. But this is based on the individual choice. They can walk, sit, and stand, do any activities if they are okay. Then comes the duration. The minimum duration should be 1 hour because frequent handling may be stressful for the infant. So once you place the baby, at least you keep the baby for 1 hour and gradually increase as long as the mother comfortably can place. Okay, then first day you keep for 1 hour, second day you keep for 1.5, 2 hours. Then if the mother, based on her comfortability, she can increase the time. Infant needs to be removed for changing the diapers and clinical assessment if you are performing in hospital according to the hospital policy. If they come for any performing any procedure, so you have to remove the infant from KMC. Now, even though it's a very normal, non-critical procedure, but duration when the baby is in KMC, you should teach and you as a nurse should be able to understand the abnormality, any warning or any signs. Monitor the duration of KMC should be recorded properly, either 2 hours per day, 3 hours, 4 hours. You have to record it. Then monitor carefully for any symptoms. That is, first is airway is clear or what? Check the breathing pattern, check the color of the baby, and maintain the temperature. Now, you train the mother to observe the danger signs during the KMC so that at home, if any changes, you can the mother can address it fast. If since the skin to skin contact, of course, when the baby's skin become molded or become hypothermic, the mother will be able to understand. Second is a respiratory problem. You can see in this animation. So this is chest retraction. You can see in the first animation. So teach the mother what is chest retraction, and these are the initial symptoms or signs which the mother can observe. And this is nasal flaring. In the second image, you can see the nasal flaring. So teach the mother these are the signs of respiratory problem, how to observe, and change in the color. If the babies become bluish in color from acrocyanosis, from the extremities, the baby is becoming blue or whole body become blue, then there is a concern. So you teach the mother to check the temperature, check the respiratory problem, and keep a watch on the color of the baby and whether the baby is feeding well. Any kind of feeding difficulty, if the baby have a refusal to feed, just have a look. Or teach the mother how to identify these problems. Some special situation for KMC, sick, low birth weight infants can be given under supervision. In this picture, it is clearly identified, even though the baby is on ventilation, the mothers have started initiating the KMC. So hemodynamically, if the preterm baby is stable or even in prolonged ventilation or in a cap mode, you can start with KMC. For special cases, sick LBW babies. And it's the best alternative when if there is no transport incubators is available in the hospital, you just want to transfer the baby. Don't expose the baby. Suppose if you take the baby to an ambulance or you are shifting from one hospital to another hospital, if incubator is not available, this is the best way of transporting the baby from one hospital to other hospital or from within hospital from one unit to the other unit. Next, we'll see some discharge policies and follow-up in connection with the KMC. A standard policy of the hospital should be followed, irrespective the mother has learned KMC or non-KMC. You have to follow the standard policy of hospital discharge policy. The baby should be stable and should not be on a parenteral medications. Okay. Maintaining the temperature in mother's bed without any radiant warmer or incubator, normal temperature with mother's bed for 3 consecutive days at room temperature. And the baby steady weight gain 15 to 20 grams per day at least for 3 consecutive days. That means the nutritionally the baby is good. Accepting feeds directly from the breast, it's a preferable mode, or spoon, palade, or cup. And the infant's weight gain is around 1.5 to 1.6 kg at the time of discharge. Mother and family members must be taught to ensure that infant should be cared at warm room and breastfed. Educate about hygiene, danger signs, follow-up visits, immunization, and prompt care. And it at home after discharge, the KMC can be continued as long as required, as long as comfortable for the mother. Now, some things which you have to be taken care when you are performing KMC. Do not bathe the infant since the weight reaches 2.5 kg. Till now, they can go for sponging. Do not handle the infants too frequently. Do not give bottle feeding. You can go for palliative feeding, cup feeding, spoon feeding, but do not go for bottle feeding. Do not allow infant to be in contact with the sick person. Reduce the chance of infection. Now, as a nurse, when you are helping the mother to perform KMC, few nurses' responsibility to reinforce is monitor the baby's vital parameters at the initial space, maintain the patency of airway for the baby, assist the mother in breastfeeding by holding the baby near to the breast. So these are few nurses' responsibility. I'm just ending the session with a video. I'll try to play the video. Hope the video is visible to all of you.
Yes, ma'am.
To everyone, if you have any queries, any questions, you can unmute yourself and ask.
Dear participants, if you have any query with that, you can just message. Thank you, Aruna ma'am, for the informative and wonderful section. I hope that all the participants understood about KMC. And if any queries, you can drop the message. And thank you so much, Aruna ma'am. Dear participants, we have another session with us on 14th, which is on Friday. So because of the Holi, we have preponing our section that is on tomorrow, 13th March, for the 9th section. The details and the timing we will update in the WhatsApp. The timing will be the same time, 2 p.m. And kindly note our 9th section. We have kept on the 14th that we preponed to the 13th, that is tomorrow. I hope that all is joining for that session also.
Tushar, are you ready for case presentation?
Yes, ma'am. Hello. Am I audible?
Yeah.
Yes, yes, sir, you are audible. Please proceed.
Tushar, are you there? Tushar,
Yes, ma'am.
yeah, you can start.
Yes. My screen is visible.
Yeah, screen is visible.
Yes. So, good afternoon, ma'am. Good afternoon, all of you. My name is Tushar Kafi from first year MSc Nursing. Today I am going to explain my case. Okay. Uh, let's see my case. Baby of X, 33 weeks, gestational age, with birth weight is 1.8 kg, delivered by LSES to 28 years old, G1,
Tushar,
P1,
can
yes.
you change your slide, Tushar?
Change.
Second slide. Yeah,
Now, now see my case. Baby of eggs, 33 weeks gestational age with a birth weight 1.8 kg, delivered by LSES to 28 years old, G1, P1, L1, A0, and D0, female with preterm. Uh, Baby of
one
eggs.
second, Tushar. Can you keep the slide share? Tushar,
Yes, ma'am.
can you keep your slide share?
My slide is visible.
Slideshow. Can you continue?
Yes. Uh, a baby of X. He is a 2 years old male. Date of admission 5th February 2025, uh, uh, and date of discharge 13th February 2025. Uh, patient baby age is 2 days. Chief complaint is hypothermia, poor muscle tone, and lethargic. And final diagnosis is preterm with low birth weight. No any fast issue of medical illness for mothers, and no surgical history, and blood transfusions and uh, uh, IV history is nil. Family history also, no any family history and cancer history for patients. Prenatal fear was unvetted. All the prenatal checkup were done. Mother was taken all TT vaccinations. She was on iron on folic acid supplements throughout her pregnancy. No GDM or PIH was present. Mother was having lacking PV. Then physical examination also done. First one is in vital sign, general appearance, and blood score check. In the vital sign, temperature is 96 Fahrenheit. Heart rate is 145 breaths per minute. Respiratory rate is 30 breaths per minute. And general appearance. In general appearance, skin color is acrocyanosis present in this case. Varnish Corsiasa is also present. Uh, Lango presents and birthmark is absent. Reflects weak motor reflex in this present our babies. And Afka score is in the 1 minute 7/10, and in 5 minutes 9/10. Then systemic examination, respiratory systems is a breathing difficulty present in the patients, and respiratory rate is a 30 breaths per minute. Intermittent systems is a acrocyanosis present in this case. All the other systems appear as normal. Diagnostic evaluations are also done. First one is the chest X-ray is normal. Blood glucose level is 60 mg per DL, and serum all electrolytes is normal. CBC also is also normal, and 2D echo is also normal. Well format heart chambers with normal thickness in this case. Then all investigation is done. First one is the serum electrolytes, sodium, potassium, calcium, complete blood count, hemoglobin, white blood cell, red blood cell, and platelet. All investigation indicates is normal. Uh, then nursing assessment. In nursing assessment, I check the vital sign, anthropometric measurements in respiratory and central nervous system, and gastrointestinal system. First one is in the vitals. Patient vitals is the temperature is 96 Fahrenheit. Heart rate is 145 breaths per minute. Respiration is 13 breaths per minute. And anthropometric measurements. First one is the height is 49 centimeters, weight is 1.8 kg, head circumference is 34 centimeters, and chest circumference is 32 centimeters. Skin in the skin nursing assessment, acrocyanosis present in this case. Respiratory system breathe normal. Respiratory rate is 13 breaths per minute. Central cerebrovascular system is S1, S2, heart, no abnormal sound present. Heart rate is 145 breaths per minute. Gastrointestinal system is no abnormal divisions found on palpation, abdomen, appearance soft. Then treatment and management. First one is thermoregulations. Baby kept under the radiant warmer, and O2 therapy given to the patients. O2 2 liters per minute provided to the O2 hood, and KMC daily KMC provided to the patients. Then next is the nursing diagnosis, nursing care plan. In the nursing care plan, first one is the diagnosis: ineffective thermoregulation, hyperthermia related to environmental changes as evidenced by baby body temperature less than normal. Then two goals is the short-term goals and long-term goals. In the short-term goals, baby will demonstrate normal body temperatures, which is 98 Fahrenheit. And long-term goal is baby will be able to maintain body temperature with normal limits. Then implementations, first one implementations. Uh, Monitor baby's body temperatures. Temperature is the 96.8 Fahrenheit. Risk factor of the achieve the ABC analysis done. Try to warm the baby properly. Lack of oxygen consumptions, provided oxygen 2 liters per minute. Baby was kept under a radiant warmer. And last one is ensure skin to skin contact by providing the KMC. And after implementation, the availability of patient's condition. After 8 hours of nursing care, baby body temperature increase to